we've been talking about rare diseases and the complexity of them, and sometimes the challenge of a patient absorbing what's being said in the physician room. Give me a sense of how you see the support of family members and other caretakers in this journey.
I think it's extremely important, and doctors can play a role by encouraging patients to always bring someone else with them, and I know you do. It's important for lots of reasons. Number one, as a patient, your perspective isn't always the same as someone looking from the outside in. Someone who lives with you on a daily basis might see things and say, wait a minute, what are you talking about? I just saw this happen yesterday. Or, so that's very important to have another perspective. But they also have a different set of ears, and they may hear things differently. And again, we all hear things differently, and we might be distracted thinking about our next question rather than listening to an answer. So anytime you have an extra person in the room who cares about you, I think is really very, very helpful. And that person can be a note taker also. Because the other thing that happens, I chose to go to most of my appointments alone, and I now know that that was a mistake. One of the things that would happen is I'd leave very confident, and then I'd get home and not remember a lot of what I really should have remembered. And so that person in the room can be a note taker as well, so that they can remind the patient and also the caretaker. And I think it's important not to minimize that caretaker, which someone I know and love calls a caregiver. Instead of a caregiver, they call it a care partner. And I think that's an important distinction, because someone like me, I don't need to be taken care of, but I need a care partner, someone who's in it with me for the long haul and is interested in my well-being as I am. And so that person is a good reminder on a day-to-day basis, but they hold on to a whole lot of stress of their own. I think it's something we don't talk enough about. A care partner or caretaker goes through a lot of, they feel a sense of responsibility. They sometimes feel guilty. They have needs that aren't really addressed very often. And so I think that's another conversation that can take place.
Yeah, so you brought up a really good point, which I figured out a long time ago, which is that care partner, that spouse, that child, that parent, whoever that person may be, that friend that sits in the room, plays a pivotal role. I've increasingly recognized that over the years, supporting that patient, but sometimes patients will bring that person so you can educate that person too, meaning exactly what you hit. There's a significant frustration, perhaps more so with ET and PV, but you do see it early on in MF where patients can feel miserable, and we call it malaise. They can have fatigue, and they can just feel unwell. They can have bone pains, but they look okay. And the family members may not, with all good intention, and they love that person, but they don't really understand what that person is trying to convey, how they feel. And something that can be very powerful if you're sitting in the physician's room and the physician is like, these are real symptoms, and, you may look okay, but look at these blood levels, and these are what really happens with patients and their symptomatology. I think it provides the caregivers and the care providers, the care team, a better sense of what that person is going through. It sort of endorses what's going through. Because I've definitely been in a situation where I've recognized that the patient is bringing their loved one for support, but also they want the loved one to understand what they're going through, not from them telling, but from the physician's standpoint and telling them. And I definitely think that having that loved one there is crucial for the ability to absorb all the information from that visit and to be able to maybe disseminate it to the rest of the family and the rest of the interested parties. I think your point about being able to explain it is a really good one. It's really hard to explain. It's hard to explain what myelofibrosis is to medical students. So I always thought that for a patient to have to sit through all of this, not feel well, and then be able to translate it to their family is not an easy task. So I think it is a good exercise if patients can figure out the best way they can, in the simplest, most clear way, explain what their disease and how it's affecting them to their loved ones. Otherwise, I think it's hard for the loved ones to support that patient if they don't understand it.